Hello, my name is Lita Gear, and I did my project on the most used antibiotics in a long-term acute care facility and the bacteria they treat. The facility where I did my practicum was a long-term acute care hospital, which is referred to as an LTAC. At my facility, we are a part of what they call a host hospital. So that means that our hospital rents out a unit or a floor from a host hospital, so it's a larger hospital. So we have a 32 bed unit which takes up one floor of the bigger hospital. So in this facility, most of our patients come to us from surrounding hospitals or sometimes from out-of-state hospitals. We take in patients that need longer term acute care, which could be up to an average of a 25-day stay. So some of them stay less time and some stay more. Um, and a lot, probably 85% of our patients are taking IV antibiotics. So a lot of our patients are there because of their antibiotic therapy. They need a longer term in the hospital because there's no other place for them to go. They can't do it at a skilled nursing facility. They can't do it at home. So they require hospital stay but longer than your average acute care hospital. Um, so that being said, most of our patients are on IV antibiotics. I thought it would be interesting as my learning objective to find out what the three most used antibiotics are and what bacteria that these antibiotics treat. So during my practicum, I spent a lot of time with our pharmacy department, which on our floor, we have our own pharmacy department, which is a 32 bed hospital. So we have our own pharmacy department, our own hospitalist. So I was able to spend a lot of time with them and also infectious disease. And our infectious disease comes to our hospital maybe about 3 times a week. They also see the patients in the host hospital and then a larger hospital that is in our area. Okay, for the comparison, um, comparing what we see in our hospital to what is seen in the research data that I was able to find, um, I was able to look at how that correlates. But first, I had to start some interviews, start seeing what information I could find at the LTAC. So first, I started with our pharmacy department. We did some audits and started compiling a list of the top 3 antibiotics. And of course, I checked with infectious disease and also with our physicians, our hospitalists, and our pulmonary group that would order antibiotics. So I compared this with the research data and with the actual data that we found within our LTAC. So also during this time and during getting my list together and getting all the data, I realized how our infectious disease department and pharmacy are in constant communication about what antibiotics our patients are taking, what their doses are, and this is all a part of what they call a stewardship program. So with the stewardship program, our pharmacy and infectious disease, they meet once a week and they determine what our patients are on, what IV antibiotics they're on, what the dose is, the duration of these antibiotics, and the route of administration. And they determine if this is what they need to stay on or if this needs to change. And it does sometimes change throughout the patient's stay. If the antibiotics are not being effective, then they may need to change it to something different. So with the information that I found out through the research data and the actual practical site, I found that the knowledge of antibiotics used in the facility, our facility, correlate with the readings on the quality and the safety. So they do correlate, and it comes down that we are giving our patients quality and we're keeping them safe with the dosage and the antibiotics that they're being treated with. Okay, so this is the comparison of the antibiotics used versus the bacteria treated. So this is the top three. The first one would be E. coli, which is probably the same in a lot of other facilities. So E. coli is a gram-negative bacteria, and it is treated at our facility with Zosyn. So Zosyn is a broad-spectrum antibiotic, and it treats gram-positive and gram-negative bacteria. And one of the studies that I found, it had 66 participants, and they were all being treated with Zosyn. And Zosyn in this study was proven to be the most effective treatment against E. coli. So this study did prove that what we're doing on our floor does correlate with this study. So, and we have found with good outcomes with our patients with this treatment also. So the next bacteria would be MRSA, which I'm sure is one of the top three probably at most facilities. And this is a bacteria found in many areas of the body. And in our facility, we treat this bacteria with vancomycin. And vancomycin is a broad-spectrum antibiotic. And vancomycin is known as one of the most essential antibiotics used. The one thing to know about vancomycin is that serum levels must be tested throughout therapy. So this is an educational part that we need to be aware of for our staff and for our patients, to know that while your patient is on vancomycin, you need to be on the outlook for these random draws, or that you may need to take before you dose this antibiotic, because their serum levels could be high and they may not need the antibiotic. And so the next bacteria that is mostly treated in the LTAC is C. diff. And C. diff is a spore-forming bacteria and is treated in our facility with Flagyl. Flagyl is another broad-spectrum antibiotic, and through the research it was found that Flagyl is the best treatment for C. diff. And the longer treatment is necessary. They have found that at least 2 months treatment is necessary for the treatment of C. diff. And this is another safety topic or education that needs to be used when nursing also, and with patients and families that come and visit the patient, that we need to do hand washing with soap and water before leaving that room. Because just the hand sanitizer doesn't work. We need to wash our hands because of the spore that is formed with C. diff. It is only eradicated with hand washing and soap. So the best practice that I found for my topic is, through my research, it was found that the LTAC facility uses best practice as it relates to choice of antibiotic to treat specific bacteria. The top 3 antibiotics used are the same antibiotics that were proven effective in the research studies. So for the personal effect that I found at my facility and for my project is, I had a chance to see behind the scenes of how antibiotics are chosen and how they're ordered and how they keep track of that throughout the patient's stay. 'Cause sometimes you just think, oh, well, they order this antibiotic and they're not checking back on it. They're just letting it go its course, but they are. Especially through our program that we have, that our pharmacy works with our infectious disease, that they're continually looking at the patient, looking at labs, and determining if this is the best treatment for the patient. And it gave me a better respect for our pharmacy and infectious disease departments, because they do work hard to try and keep our patients well and to do what's right by our patients. And the information learned educated me on the most used antibiotics and the bacteria that they treated in our facility. I think as a nurse, that when you are dosing a medication, you want to know why. And it's helpful to know why, because it can cut back on any safety issues that you may have with medication dosing. Mismedications, or dosing the wrong medication. If you know what bacteria they have, then you know what antibiotic they're going to be treated with at our facility. I review the education that is given to our staff with our pharmacy department, infectious disease, and we are yearly educated on our proper PPE use and the importance of hand washing that prevents the spreading of infection. So we're always educated on those so that we're not spreading this bacteria from patient to patient, because I know um, that we have seen before that C. diff has been spread from one room to the next, and that's because we're not using our PPEs correctly, or we're not washing our hands as we should before we leave the room. And then after this practicum, I feel like that I will focus on why I am doing something for the patient and not just going through the motions. So this has made me more aware of what antibiotics that we use to treat our patients and the bacteria. So I think if we do more education for staff and also for family members, that it will help with better outcomes for our patients. So thank you for listening to my presentation, and